Alright, welcome back. Now we're going to further progress the dead bug exercise into the true dead bug, which is an isometric position with some of the breathing that we talked about earlier. So Michelle, go ahead and raise your arms straight towards the ceiling. So her arms are perpendicular to the floor, and she's going to again raise her feet up into the 90-90-90 position. So 90 degrees at the knee joint, hip joint, and ankle. And from here, she's going to focus on putting pressure into the low back end of the ground and going through her full breath cycle here, starting with the stomach, moving to the ribs, ending at the sternum with movement. And the exhale is the same order but opposite, so I guess the opposite order. Now, one thing I wanted to talk about was if you are having trouble feeling your spine pressing into the ground, you can use a prop. Roll up a little towel and go ahead and relax, Michelle. And place the towel under your low back in the center, right about here, just at the top of where your hip bone is. And from here, when you activate your core and you feel the bony part of your hip and your ribs coming closer together, you can squeeze that towel and get a sensation, helping you ensure that you're doing this exercise properly. Okay, now let's progress this into a more dynamic dying bug exercise. And here we're going to have leg movement and arm movement at the same time. So from here, Michelle's going to activate again her back into the ground, making sure that her ribs are pulling towards her ASIS there. She's going to start breathing, making sure that her breathing pattern is controlled and accurate. Slow 3-second breath in, 3-second breath out. And now we're going to add the leg and arm movement. So you're going to go ahead and lower your right leg for me as you lower your left arm. Tap the floor with your heel and your thumb, and exhale as you come back up. Good. Other side, inhale as you go down. Tapping the heel, tapping the thumb, reconnecting with the back. This is really important, making sure the back is connecting here as you exhale on the way back up. Let's show one more for us, Michelle. Very good. You can see how she shakes when she contracts at the bottom, because this is where it requires the most effort to keep your ribs and your pelvis coming close together. Okay? Thanks a lot.